the anaesthetic machine. And then this is just my office, basically. All my drugs here. Fridge to keep some of them. Okay, so I'm just in the pain office. So aside anaesthetist, apart from doing intraoperative work, so giving you an anaesthetic to keep you asleep, unconscious and unaware of pain during an operation, we also see patients on the wards post-operatively for pain management. So I do a pain round about once every 2 weeks, and I go around with pain nurses, specialist pain, clinical nurse specialists. We see patients post-operatively, and I think it's great because it allows you to, it's a feedback loop for what you have done intraoperatively. So we give a lot of medications intra-op. There's a lot of pain management tools that you can use for ongoing pain, depending on not severity, but the extent of the operation. And so it's good to see patients afterwards to see if it was effective, and to give you, like I said, a feedback loop. It's great to get out on the ward sometimes because I'm mostly in theatre and mostly see patients at their most vulnerable. It's nice to see them afterwards when they're up and eating and drinking and so on and so forth. So as well as pre-op assessment, so seeing patients before the operation and then intraoperatively with, which is the bulk of my work. I'm mostly in theatres, and then post-operatively I manage pain in the acute setting. Chronic pain is a whole different ball game, but it is part of the anaesthetic service. So if you don't know, I'm Dr. Nix and I'm an anaesthetic consultant working here in London. I specialise in paediatric anaesthesia. And this is the bulk of my clinical work. I do have a more diversified portfolio, but I'll get into that in another video. Give me a follow, subscribe if you haven't already. If you want to know more about what I do and what my portfolio career looks like, this is part of my clinical work. So the good thing about this is my day doesn't start till 9 AM, again like clinic, and I finish by about 12:30. Yeah, so I'm just going to document some stuff, and then that's it, I'll go home.